As a maternity care provider, you hold and care for others every day. Who holds you? Welcome to The Resilient Birth Worker. I'm Sarah, naturopathic doctor and lactation consultant. This is the space for midwives, doulas, nurses, and other maternity care providers feeling stuck between offering the care mothers truly need, the demands of our culture, and the restrictions that serve the system instead of the humans within it. Together, we're on a journey to more rest, resilience, and healing. When you feel more resourced, so too are the families you hold. When your energy is restored, so too is the life you desire. Let's root in. Welcome back. Today, we are going to talk about the cost of caring. As someone called to caring for mothers and babies, it's highly likely you're an empathic person, and the evidence suggests that isn't a coincidence. Research consistently shows that individuals with high empathy scores are naturally drawn to people-oriented professions. Studies on medical and nursing students show that those with the highest capacity for connection are the ones who choose specialties like midwifery, nursing, and counseling over procedure-heavy or technology-focused roles. You chose this work because you naturally and instinctively care, and that caring matters. We know from the data that high provider empathy leads to better patient outcomes, increased patient satisfaction, and even fewer medical errors. But the research also shows a shadow side. While high empathy is vital for the patient, it can be dangerous for the provider if it isn't the right kind of empathy. Today, we're going to look at the difference between cognitive empathy and affective empathy, and how conscious awareness of that distinction is key to stopping the energy drain. When we say empathy, we are usually talking about two different neurological processes. First, there's cognitive empathy. This is the ability to intellectually understand another person's perspective. It's looking at a laboring mother and thinking, she is in pain, she is scared, and she needs support. Research suggests that this type of empathy is actually protective against burnout. It allows you to be effective and feel the satisfaction of helping. Then there's affective empathy. This is often called emotional contagion. This is when you share the patient's emotional state. Your mirror neurons fire, and your body physically replicates their distress. If they are panicked, your heart rate goes up. If they are grieving, you feel a heaviness in your own chest. Here's what the studies tell us. Unchecked affective empathy is a primary risk factor for compassion fatigue. If you are unconsciously and constantly operating in affective empathy, feeling with them rather than feeling for them, you are biologically merging your nervous system with theirs, and that is unsustainable. I like to think of this in terms of being a sponge versus a witness. Without awareness, it's easy for many of us to operate as sponges with affective empathy. We walk into a birth space or a clinic or a family's home, and we soak it all up. The anxiety of the partner, the pain of the mother, the tension of the hospital staff. By the time we leave, we are heavy, soggy, and saturated. But the most resilient birth workers learn to operate as witnesses with cognitive empathy plus compassion. Compassion is distinct from empathy. Compassion involves noticing the suffering through cognitive empathy and having a desire to alleviate it. But, and this is critical, staying rooted in your own body. The witness sees the pain. The witness acknowledges the difficulty, but the witness knows where they end and the client begins. Now, I know what the unseen armor is whispering to you right now. It's saying, but Sarah, if I don't feel it with them, won't I be cold? Won't I be distant? Here's the truth. Your client does not need you to join them in the storm. If a mother is being tossed around in the emotions of her labor or her breastfeeding struggles or her postpartum anxiety, she does not need you to jump in and get whipped around with her. She needs you to stand steadily rooted, like a giant oak tree, and reach out to her and say, I see you. I've got you. I am safe. When you stay regulated, when you stay rooted in your own body, you act as an anchor. You lend them your steady nervous system. That is supportive co-regulation. It is better for everyone for a mother to co-regulate with your steadiness than for you to co-regulate with her storm. So, how do we move from affective empathy, the sponge, to compassionate witnessing? I use a simple visualization tool, the screen door. The next time you're with a client and you feel that wave of anxiety or heaviness hit you, when you feel that emotional contagion taking over, I invite you to pause. Visualize a screen door between you and the client. A screen door allows the fresh air to pass through. It allows connection, love, and information to flow freely, but it keeps the bugs out. It keeps the frantic energy, the trauma, and the urgency on their side of the door. You can say to yourself internally, I see your pain. I honor your experience, but I will not carry it in my body. This is how we protect our longevity in this field. This takes practice. I know from experience. We are conditioned to be sponges because we care so deeply. But remember the research. The best outcomes happen when you can understand their perspective without losing your own. If it feels really tricky to start with the screen door practice during a client session or while attending a birth, remember to pause immediately afterwards and check in with how you're feeling. And ask your body, is this mine or should it be left behind? To finish today, let's take a breath. Imagine gently closing that screen door. You're still present. You're still loving, but you are safe on your side of the threshold. Be well, be rooted, and be resourced. Until next time. I'm so grateful you took the time to nourish yourself today. If this episode helped you feel a little less alone and a little more steady, I invite you to follow or subscribe and continue nurturing rest, resilience, and healing. And if you know someone who would benefit from the ecosystem of support we're cultivating here, please share the podcast with them. Until next time, be gentle with yourself.